Central lines are to be done every 7 days, or PRN if they're soiled or if you've got a corner that's non-adherent. You just want to change the whole dressing. Your claves that are on all central lines are supposed to be changed with every blood draw. If you're not drawing blood from that line, you'll change it every 72 hours. And then your IV tubing that's connected to central lines, it can be good for up to 72 hours if you're leaving it connected, but if it's intermittent and you're swapping out antibiotics or drips or whatever you're running, you have to change the tubing every 24 hours. So the little orange stickers that you label your tubing with are really helpful, so make sure you're putting those on there. When you change your claves, you'll of course want to make sure that you prime the new clave first and then clean this hub with your Provantic swab before you apply the new already primed clave. 10cc syringes is all that we use on PICC lines. Nothing smaller. It'll increase the pressure within the line and a tip of it could break off, and we don't want that. If you get, what unit are you from? If you get a patient that has a port, whether it's a power port or a meta port that needs to be accessed or the dressing needs to be changed, call up to BT5. Whenever the dressing's changed, the needle has to be changed as well. So you have to be certified to do that. So BT5 is your go-to for all things ports.
So are they changing the needle out at the same time? Change a new needle?
Yeah, they'll de-access, then re-access with a new needle and put a new dressing on. So it's supposed to all be done at the same time. You don't just change the dressing, you change the whole thing. Did we talk about CHG wipes? CHG wipes for all central lines are to be done every 24 hours. You can delegate it, but it's ultimately the nurse's responsibility to make sure that it's done and that it's charted. It doesn't take the place of your bath, so you still need to be bathing your patients and do the CHG after the bath. If you do the CHG and then the bath, the soap will rinse off that chlorhexidine and completely defeat the purpose. So bath and then CHG every 24 hours. So for your skills checkoff, I don't think that you've got, you have CHG on yours, but not the line. So I'll sign yours. But ER, you'll have to walk me through just verbally how you would change a dressing and put a new one on.